When a person has chronic abdominal pain before age of 50, in most cases it is irritable bowel syndrome. People usually describe it, I have stomach pain, especially in the lower part of abdomen, but tests show normal result, no abnormalities on ultrasound or endoscopy. This pain is often relieved by defecation, and people often related the pain to stress. Pain comes in waves, especially after eating. Sometimes people say that they have unpredictable bowel habits, like alternating diarrhea and constipation, and they have a feeling of incomplete emptying or urgency to defecate. They also describe stomach bloating or a swelling sensation, especially worse in the evening. It feels like a gas, discomfort, or food intolerance. People often say that certain foods are not good for the stomach. Irritable bowel syndrome affects around 11% of general population. It's twice as common in women and it usually affects people under the age of 50. There is no visible damage or change in the intestines. It looks completely healthy. But abdominal pain or stomach pain occurs recurrently and lasts more than 6 weeks. The symptoms fluctuate. Sometimes they get worse, for example, during stress, menstruation, or after eating certain foods, and sometimes they get better. It significantly affects quality of life. There are several types of irritable bowel syndrome. When a person has stomach pain plus constipation, it's common. Second type is when a person has stomach pain plus diarrhea, also common. Another type is mixed form when diarrhea and constipation alternating. And another type is when there is no clear pattern. It is called IBS unclassified. The most common sign of irritable bowel syndrome is abdominal pain, bloating, and distension. They occur in almost 85% of cases. Constipation or diarrhea also very common, almost in 90% of cases. Urgency to defecate occurs around 60% of patients. Mucus in stool around 40% of cases. Incomplete evacuation, nausea, vomiting, and anxiety also very common, around 50% of IBS cases. The mechanism of IBS is multifactorial. There is no single cause. Usually, it's an interaction between brain and gut. The microbiome also important. Bacteria in the gut. Our gut constantly communicates with the brain via nerves, especially the vagus nerve. And this communication is dysregulated sometimes, leading to exaggerated pain perception from the normal processes. It is called visceral hypersensitivity. And it is considered the main mechanism of IBS. Another cause is altered colon transit. That's why we get sometimes diarrhea and sometimes constipation. It contributes signs like urgency, diarrhea, and constipation. And microbiota imbalance or dysbiosis is also important. IBS patients have less diversity and more pro-inflammatory bacteria in the gut. Small intestinal bacterial overgrowth is also important when gut bacteria from the large intestine move into the small intestine and start to grow. It happens around 40% of IBS cases. That's why antibiotics help relieve symptoms in people with IBS with diarrhea. The first line treatment of IBS is low FODMAP foods. FODMAPs are short chain carbohydrates that are poorly absorbed in the intestine. They pull water into the bowel and are fermented by gut bacteria. This causes excess gas and pain. They can lead to bloating, cramping, urgency, diarrhea, and constipation. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Fermentable means that these foods are fermented by bacteria or digested by bacteria. Oligosaccharides include fructans, they found in some grains and vegetables, And disaccharides include lactose, found in dairy products. Monosaccharides include excess fructose, found in some fruits. And polyols include sorbitol, mannitol, and xylitol. These are artificial sweeteners. Now let's see top foods that are high in FODMAP, and it's highly recommended to eliminate them if you have IBS. Such foods are garlic, onion, wheat, like bread, pasta, and cereals. They contain fructans, rye, barley, asparagus, artichoke, beetroot, broccoli, cabbage, cashew, and pistachio. Milk, ice cream, and yogurt, they contain lactose. Soft cheese and other dairy products due to lactose composition. Apple and pears due to fructose. Watermelon, mango, honey due to high fructose level. Peach, plum, prunes, cauliflower, and mushrooms because they contain polyols. Avocado, beans, kidney beans, they contain oligosaccharide. Lentils, chickpeas, and soybeans, and gums with sweetened by sorbitol or mannitol or xylitol, and soft drinks with fructose. Now let's say about low FODMAP foods which are safe to eat. Such foods are carrots, zucchini, eggplant, cucumber, bell peppers, tomatoes, spinach, lettuce, and green bean. Rice, potatoes, pumpkin, kale, Swiss chard, quinoa, oat, and buckwheat. Firm tofu, chicken, turkey, beef, pork, fish, all type, and eggs. Hard cheese like cheddar, Swiss, and Parmesan. Lactose-free milk, lactose-free yogurt, and almond milk. Butter and olive oil. Grapes and strawberries, blueberries, oranges, pineapple, kiwi, banana, dragon fruit, lemon, and lime. Now let's say easy way to choose FODMAP-friendly foods. Generally try to avoid foods with lots of sugars. If you eat dairy products, choose lactose-free or hard-aged dairy. Avoid foods that cause excessive gas and bloating like onions, garlic, and legumes. Avoid processed foods and sweeteners like sorbitol and xylitol. If you eat FODMAP foods, try to reduce portion size. For example, instead of 3 slices of bread, eat only 1. Total avoidance is not necessary always, but for better results, strict avoidance is preferable, especially in the elimination first phase. In the reintroduction phase, slowly test your tolerance for each FODMAP food groups. Many people can eat small or moderate amount of certain FODMAP without symptoms. Almost 80% of patients improve symptoms significantly with low FODMAP diet. Improvement is seen usually 2 to 4 weeks. Now let's say about medications. IBS with diarrhea. Loperamide is used to reduce diarrhea. It's effective almost in 80% of patients. Regimen is 2 to 4 milligrams after each loose stool, but the maximum dose is 16 milligrams per day. It comes as oral tablets or capsules. But it does not relieve pain or bloating and may cause constipation if overused. It is not recommended for long-term or daily use without breaks. Antispasmodics are also effective, like dicyclomine, Buscopan, or Noshpa. They have around 60% effectiveness. Noshpa is rotavirine. For dicyclomine, the dose is 20 milligrams up to 4 times per day. For Buscopan, 10 to 20 milligrams 3 to 5 times per day. And for rotavirine or Noshpa, 40 to 80 milligrams 2 to 3 times per day. Usually they come as tablets, sometimes as syrup. Noshpa usually have fewer side effects compared to others. Side effects may include like dry mouth, dizziness, and blurred vision, but Noshpa still can cause nausea in some patients and sometimes low blood pressure. Rifaximin is also used, but as a second-line treatment. It's effective, especially in patients with bloating. Rifaximin is an antibiotic and is taken 550 milligrams 3 times per day for 14 days. It can be repeated up to 2 times if needed. This antibiotic is effective diarrhea dominant IBS, not in constipation. Tricyclic antidepressants like amitriptyline can be used also. They reduce pain and diarrhea and urgency almost 60% of patients. Usual dosage is 10 to 25 milligrams at bedtime. Those can be increased if needed. It's usually taken as oral tablets and may cause drowsiness, dry mouth, and constipation, usually used after 12 weeks, but can be taken for long term if needed. For IBS with constipation, first-line treatment is polyethylene glycol, lactulose, or psyllium for constipation. Polyethylene glycol is taken around 17 grams dissolved in water daily. Psyllium is taken 1 to 2 teaspoons in water once or twice daily. Usually they are powders that are dissolved in water. They are safe for long term, but you should start with low dose because especially psyllium can cause gas and bloating. Antispasmodics also can be used due to pain and spasm. Fluoxetine or sertraline antidepressants can be used because they improve pain and bowel habits in some patients, around 50% of cases. They usually take in standard doses, for example, fluoxetine 20 milligrams per day. They are usually used for long term. Now to summarize, with diet and simple medications, IBS can be managed in 80% of patients. IBS chronic but non-dangerous condition. Serious complications are rare and quality of life improves with most patients who follow treatment and avoid triggers. Complete cure is uncommon, but most people control symptoms well.